I think what you'll see here as part of this workshop is quite unique and performed only in a few centers around the world. I can't give you the exact number, but maybe a dozen or a couple of dozens or so. Both are very conceptually quite different. Once you get into the heart cavity where the valve is, when you do a minimal invasive valve, provided your exposure is good, then you're set. Once you've actually arrived to the left atrium or the aortic root in order to replace respectively the mitral valve or the aortic valve, then you're okay. You don't have to move things and you can start working. And you don't start working until your exposure is perfect. So that's the principle that all of us follow when we're doing minimal invasive valves. Minimal invasive coronaries are different because you have to change your exposure all the time. You're basically, 1 minute you're working on the chest wall artery called the mammary artery. The next minute you're working on where you attach the bypasses. That area is called the ascending aorta. Then you graft each vessel. So you have to move the heart around, and it becomes an exercise in exposure. And as Gopichand was saying, it takes you very much away from your comfort zone. But I like the concept that was mentioned by him earlier, that you make it a routine practice and you transfer some of your comfort towards the comfort of the patient. And it's really doable. And we hope in this workshop to be able to convey the message that you can do it very safely. We've shown in our series that it was very safe. I've never had a death from this operation. Touch wood, like already.
Any questions for us? And then we open the chest. We have all these things. So our hands are good enough. Small instruments to Jason. Easy out. Whereas, go back to this. You have no way of putting any of your hand, and your operation field is further out. To reach that, we have to have special instruments designed to open only at the tip, not the entire needle hole open చేయాలనుకోండి, ఇక్కడి నుంచి ఓపెన్ చేయాలి. ఇక్కడ చిన్న మూమెంట్ చేస్తే అక్కడ ఓపెన్ అవుతుంది. సో అటువంటి స్పెషల్ ఇన్స్ట్రుమెంట్స్ ఆర్ ఆల్ డిజైన్. తర్వాత ఈ చిన్న ఇన్సెషన్ కాబట్టి దానికి చుట్టూ ప్రొటెక్షన్ కోసం ప్లాస్టిక్ సాఫ్ట్ టిష్యూ స్ప్రెడర్ అంటారు. అదేవిధంగా ఈ ఇంటర్నల్ మామరీ ఆర్టరీ మామూలుగా మేము ఫుల్గా ఓపెన్ చేస్తే ఇక్కడ నుంచి కనపడుతుంది కంటి. వేరే ఇక్కడ స్పెషల్గా దాన్ని టిప్ చేయాలి, కొంచెం లిఫ్ట్ చేయాలి చెస్ట్ వాల్ని. హార్ట్కి చెస్ట్ వాల్కి చాలా తక్కువ స్పేస్ ఉంటుంది. సో టు క్రియేట్ కొంచెం మన ఇన్స్ట్రుమెంట్స్ తోటి ఆపరేట్ చేయడానికి స్పేస్ క్రియేట్ చేసుకోవడం కోసం ఇలాంటి స్పెషల్ రిట్రాక్టర్స్ డిజైన్ చేశారు. దీన్ని మళ్ళీ లిఫ్ట్ చేయడానికి రూల్ ట్రాక్ట్ అని ఒక వైర్ తోటి లిఫ్ట్ చేసే స్పెషల్ పుల్లి లాంటిది ఉంటుంది. సో ఇలాగా రకరకాలుగా ప్రతి స్టెప్కి we have to get ourselves familiarized with the new technology and new instrumentation. Next. This is the valve case, I am Jason valve case. Next. This is final outcome incision. They are small under the nipple. This is actually 6 centimeters incision. Valve replacement. Generally 20 centimeters easy. పైన కింద కనీసం 20 centimeters అయితే ఈజీగా. దిస్ ఈస్ ద స్టాండింగ్ ఫ్రమ్ ద చిన్. థ్యాంక్ యూ. ఈ పురుషుల స్త్రీలలో ఫర్ us in those patients. నార్మల్ సర్జరీకి మినిమల్ సర్జరీకి స్మాల్ ఇన్సిషన్ తోటి ఇన్స్ట్రుమెంట్ నేను ఒక్కడే చేయగలను. లోపల ఎవరికి యాక్సెస్ ఉండదు. My assistant cannot help me to do this operation. The entire steps and everything need to be done by the person, whoever is doing. My colleague is doing or surgeon, the main surgeon. So, ఒక instrument బయటకు తీస్తేనే I can put another instrument. So it takes that kind of time. Creating access is going to be a little longer. తర్వాతనేమో femoral artery ద్వారా యాక్సెస్ ఉంటుంది హార్ట్ లంగ్ మెషిన్. అవి సరే setting up mammary artery retractor and setting up itself takes 10-15 minutes. So all these things take add-on time, but with experience, I don't know how long it takes.
It's longer. than a regular operation. So it becomes very manageable. When we started back in 2005, those operations, believe it or not, took 7 hours because we had no idea what we were doing. So we were basically developing the technique. And also when you start, we had to perform the operation on patients who were not selected whatsoever because people were not being sent by their cardiologist and saying this would be a good mixed candidate. So I had to, my first operation was a 4-vessel bypass in someone who was obese, as is typical in North America, and we just had to manage it. Then over the years, you get referred, a lot of patients are coming from other hospitals, from other areas in the country saying, would I be a good candidate for this? I just need 2 or 3 bypasses, etc. And of course, they are very good candidates. So I think when you start, there is what we call a learning curve. It takes longer, and it should take longer. It's a little bit like when you're preparing, this first space shuttle mission. The first time that the space shuttle went, they probably, they worked for it for years and years and years and years. And then when it came later on, it became easier. So it's the same thing with this operation.
Psychology, 3 days do we have any patents on this procedure?
Done through a keyboard. So any patents that protect them? No patents for this.
So with the help of the medical equipment firm you evolved, or who initiated this first?
So it's actually, and we don't have stock options. But when MIX was developed, initially there were some early instruments that are not used anymore. And my colleague Joe McGinn and I have worked with Medtronic. And when I, for instance, would be aware of this, about 4 or 5 years ago, we helped Medtronic develop the instruments that we are using today for coronaries. I don't know what Dr. McGinn in New York did, but personally I refused all type of stock options or any financial benefits related to the instruments because I'm an academic surgeon. I come from a university. What I do is research and operations, and I consider this as part of my mission, which I'm sure Gopichand is considering as well. So I think it's important to be independent and not sell this as a product. So we are not salesmen. We are promoting something which we believe helps patients and society, especially in a country like India.